question is how, because I'm struggle in the same problem. I would like to know that how to do if I try to invite them to have a party, casual group dinner like this, but they said no.
Okay. Oh, how to help? I don't know, Prof. Tan, you want to jump in on that anytime as well. But if you invite people for a party in your house or wherever it is.
No. I mean our staff or colleagues try
Yes.
to have a small group chit chat, but they said no.
Okay. It doesn't work all the time with all the people. But if you invite 10 people and 5 people say yes, please carry on. Because the other 5 will hear and say, I was invited, but I didn't come. Everyone had a great time. Oh, next time, I will come. You have to start somewhere. You cannot win 100% of the people 100% of the time, right? So if you invite 10 people and 5 people say, yes, they're going to come, let them come. Enjoy yourself. Take pictures, put it on Instagram, and then the rest of the people say, oh, I should have been there, right? That's the stress for them because they don't want to come. But you have to celebrate the win. Whether it's a big win or small win. You invite 10 people, all 10 come, fantastic. But if you have a party and you invite 10 people and 2 people come, you still enjoy yourself. Because you want to de-stress. You are thinking, I want to make people happy, right? And one of the great things about this event that is here in Bangkok from HAI is you look at all these people who are sitting over there and smiling. If the camera goes there, they are constantly sitting there and smiling. And I really like coming to this event because the organizers are always smiling. They are always happy. They are working until 1 o'clock in the morning. They are very stressed. But because they are happy, there's 6,200 people who are happy here. Because when you walk out there, it is infectious. It is infectious in that sense. Not an infectious disease, but it's infectious. You know, it just comes out. And I see the entire team is, no matter what happens, they're always standing there and they're smiling. And that is the benefit of doing something, and you want to be joyful at work. That's what it is. Is Prof. Tan on?
Thank you. They have a question for Dr. Tan.
Oh, you have a question?
Yes.
Prof. Tan?
On the screen. Or even you can unmute and talk by yourself.
In encouraging the environment.
Okay, this is the question. My hospital has a mental health support service for staff, but staff don't want to talk with the therapist because they are too close with each other to know each other. Or they are too close with each other or know each other. Even not too close, but some staff don't want to talk. What are your suggestions? Prof. Tan, are you on the line?
Sorry, can you hear me?
Yeah, Prof. Tan?
Dr. Tan, sorry, we will proceed on unmute you. Sorry.
Yeah, we can hear you now.
Yeah, can you hear me? Because just now I was, So I think I agree with you because the leaders play a very important part, right? You can see teams, if the leader is a very cheerful person and will encourage them, and the team itself will respond accordingly. And if the leader is a bit, down and sometimes it becomes a problem. So as a leader of the team, you have to be mindful of people's working hours, right? So if you were to invite people or do anything, do it within the working hours or a reasonable non-working hours time itself. Because nowadays, we also sort of very mindful of the off working times. So in fact, we actually remind people do not send too many emails at night. And if you send an email, just remind them they do not need to respond immediately. However, there are leaders who say, who organize very good events, and most people who wants to go. So it's actually a balance now of trying to take time into their personal time and their work time itself. So to ensure that the work time doesn't infringe on others' personal time as well. But it's important to be able to optimize, and if you do have a party, make sure that people enjoy themselves and it's meaningful for them as well. So I think nowadays we are mindful about the personal hours, and this is the way the younger generation works as well, that they do have more personal time as well. So we are mindful of that as well. Yeah.
Yeah, I absolutely agree. We can't win 100% of the people 100% of the time, but we can, open up ourselves to doing things a little differently, and we set these things in motion. Some of the question that we were talking about is, if people don't want to talk, that is absolutely possible, because some people from the younger generation who are very tech heavy, they don't want to have conversations. They're not good at it. But maybe if you put a PS5 there, they are more adept at communicating with you on a different level, right? So there's different strokes for different folks, right? Prof Tan, you were saying just now, the technology is there. We can use a lot of different tools, whether it's karaoke, whether it's pool table, whether it's a PS5, whether it's going paintball, whatever, going cycling. So we just want to create the activities. Not 100% of the people are going to come, but even 5, 10, you're building your team, you're allowing them to build a relationship with you. And once a relationship is built, no matter in what form, then you will be able to open and have those conversations, right, with them. Any other questions?
I want to invite Dr.
Yes.
Shan to come to the stage.
Dr. Shan has got a question.
Yes, please come.
Hi. Actually, my question is for Prof Tan. It's regarding something in a slide earlier I saw which caught my attention. You mentioned something about psychological safety for workplace, which involved speaking up. So as a young doctor last time, I remember getting scolded by one of my nurses because I did something wrong probably. But I didn't take it in a wrong way, and I accepted it as a constructive criticism, and I improved. But there are also times in a healthcare setting where you have senior consultants or senior doctors who don't like getting called out when a junior or subordinate highlights something to them. What's your advice on mechanisms to give that kind of a workplace safety, and how would you handle these kind of incidences? Example, if a nurse picks up something, say a possible medication error, and questions the doctor's practice, and say the doctor is a very senior doctor, starts, probably scolding her and questioning his authority. He feels his ego is being brushed. How would you handle that kind of scenario, or what kind of processes are in place in SingHealth to address these kind of things? Because I think speaking up is something that every healthcare personnel should have the ability to do it, but then managing the repercussions is what I want to know about.
Yeah. So that's a very interesting question. So when we sort of encourage speak up, it's not just about speaking up, right? Because if you try to speak up in an environment that's not conducive, you're going to get a lot of fallback on it itself. So we teach, we actually role model for all the seniors, in fact, every staff to be able to listen up. And to be able to respond in a way to thank the person who is raising the issue, even if it turned out in the end the person who raised the issue is wrong, because the person is trying to address a certain issue itself. We make sure that the environment is conducive to this right up to the group CEO level. We also make sure that the staff understands that if the responder comes out in a very harsh way on the person, then how does he or she is going to respond? There we have a program that teach them how to respond. Basically, if you find that it's been abusive, just step a bit back and then recollect yourself, and then you can sort of raise the issue again in a very polite way. Or if it's not really a safety issue, you can keep it to yourself because you still don't know how to respond, and you think about it, analyze it, and you can raise the issue back with the same person, or you seek a workplace champion who will be able to talk to that person itself. So it's a whole series of things to support that particular act of speaking up. The first time it may not get right, but if a lot of people are doing all the time, for example, if you see my background here, right? I don't know whether you can see because it's sort of cut off. It actually says, speak freely. It is a safe place. And there is a Sing Health orangutan hanging behind the branch itself. The reason why I put it is not for fun, because it's now the official Zoom background. If we attend the CEO CMB meeting, just started today, everyone is encouraged to put this up because the new group CEO felt that psychological safety is very important, and he wants to encourage people to speak up freely itself. So there's this environment that allows, so even if you get a negative response, you don't feel that you are odd one out because you are speaking freely. So that shouldn't be a issue or embarrassment for you because everyone is doing it itself. Does that answer your question?
I want to just chime in as a patient from a different point of view where I totally agree with what Prof. Tan is saying. As a patient, if I'm the patient there, I'm about to be given the wrong medication, right? And if I take that wrong medication and I am harmed by it, I don't want to come back and complain about it and then hear that the hospital's policy was, oh, the nurse is not supposed to tell the doctor. My life was at stake. Something has happened and I was harmed by it. And it's first do no harm, right? I thought that's the number one tenet of the Hippocratic Oath. That seems to be forgotten somewhere along the line because it's like, don't tell the doctor that he made a mistake. You know, it's the patient that needs the reason why y'all are doing this is to save the patient, right? So I understand it's a mistake, so I'm just giving you a different point of view on that, the patient's point of view, that we are afraid that, if something happens to us, we want to complain. If we want to complain about that harm, then, don't come back to us with procedures and processes that don't help us. We've got another question from Dr. Bruce. Yep.
Yeah, thanks to you both, I think, for the presentations and discussion. It's such a timely topic, and back in the United States, we are facing this as well. And it's complex. I mean, there are a lot of issues related to monetary compensation as well as joy in the workplace. But I want to circle back and to the connection of joy in the workplace to the quality of care being provided to patients at the same time. And in the old days, we used to use that as a motivation to incentivize providers, that, if you are able to provide good care, there was some kind of intrinsic reward that motivated you. You both alluded to this a little bit, but I wonder if you could comment a little bit about this, because I want to say, first of all, I believe that it's important to support the workforce. It's critical, absolutely critical. But this could also become more of a gratification process for the worker and lose sight at the same time of the importance of providing care to patients. So I'm just wondering if you could talk about that balance a little bit. I hope that was clear.
Sure. Prof. Tan, you want to take a stab at this?
Yeah. So, of course, the patient outcome is it's actually the number one thing. In fact, the motto of Sing Health is patient at the heart of all we do. And patient safety is the number one thing that we look at. So, and is in fact the number one thing. And I would say that's even more important than staff safety. Although staff safety itself contributes to patient safety. Without staff safety, you wouldn't have patient safety. But in the whole rhyme of things, is in the end, it's actually the patient, and that's why we are engaging the patients much more now. And in fact, patients, they are again different. Some patients are very activated, they're very high activation, and we bring them to become partners to help us to look at issues and to help us with the care. Some patients are very poorly activated, they're always not in compliance default, and we have a person-centered care coordinator that looks at how we can bring them in itself. So we look at it from the patient point of view. It's just that now we realize that we have to go a bit more and staff becomes a undergirding point. So it is important to enhance staff safety, staff psychological safety to be able to bring about the patient safety. The issue just now was brought up, right? About if it's a patient safety issue, when we speak up, there are graduated levels. You know, in team steps, which we taught also as well, and in our teams speak. You know, there's this CUS, right? Firstly, you say I'm concerned, and the message will get to the other person. If the person doesn't seem to respond, you just say I'm uncomfortable about it. You know, I sort of very uncomfortable. And if at that second level, the person still doesn't respond and still doesn't react according to what is might be done, whether it's a senior person or not, you can say this is a safety issue in your mind, and you can raise it up directly to the person, and also ask it that another senior person be tasked to look into this. So when it concerns about a patient safety issue, it is not negotiable, and the staff will be on the spot, will be given the authority, so to speak, within the environment to be able to directly challenge the person at the highest level. See, this is a patient safety issue. I would like to go like to your superior to talk about it, or I think we should stop and then we should look at it to stop the migration process from going on. So this is what we meant by a step-up, respectable way of raising your concern. It is because our staff are not trained to raise up in a very in a graduated way. You know, so sometimes, you know, if you have a nurse shouting at the doctor, say, "Hey, please wash your hand," or something like this, you know, like a very angry tone, and that's where the person on the other side feels very disrespected, and that's where the issue comes. So we train our staff to raise issue in a very respectable way, and if it's a safety issue, it's non-negotiable. Does that answer the question?
Yeah, I hope it does, Dr. Bruce. Yeah, I just want to add in that this is my view as a patient is people who are in healthcare, it's not a job. My view is it's not a job for you, it's a calling, right? So it's higher than a job. I agree that it's not across the board 100%. A lot of people who are in healthcare think of it as a job, right? A serious number of people that I know think of it as a calling because they look at it as, I get to have this opportunity to save somebody's life, to transform somebody's family, to do all these things. And I see there are that number of people. I look at healthcare by and large as a patient, as a person who's been in the system, I look at them as a calling rather than just a job. That may not be right across the board, but you know, this is how I feel. So incentivizing them is important, but always constantly building capacity, because I feel if someone wants to be incentivized, there are ways of incentivizing them, you know, building their capacity, sending them to conferences like this, making sure that, you know, they're first in line for a lot of things, provisions that we can provide for them. So that is another way that I think that's going to happen. Do we have any more questions? Or we run out of time?
No more question, but about 5 minutes remaining.
Oh, okay.
Yes.
Five more minutes?
5 minutes.
Okay. Do we have any more questions? Do we have any more questions on Zoom or anyone here? Ladies, any questions from you? Any questions? Any questions?
Maybe Mr. Manvir can sing one song for us. Yes.
If I sing the song, the entire conference will be over.
Oh, really?
I didn't suggest the karaoke because I can sing. No. I don't like singing. No. Maybe Dr. Tan can sing. But I like that I can say speak freely. It's a safe space with the orangutan. It's a lot of fun, you know. It's a lot of fun, and we need to be able to laugh and celebrate these little things that we do. Well, Prof. Tan is frozen there. So any more questions? Any more questions on Zoom? None? None. No worries. Okay. Well, I guess you can close. Thank you very much, everyone. Thank you.
Thank you so much. ขอบคุณค่ะ